Hey there guys and girls, so I want to take a quick 10-minute video maybe and do a quick video on first aid. So I recently started work with the Cubs and Scouts and last year I did a paediatric first aid course which really got me looking more into my first aid kit, so I thought I'd run you through what I carry generally. So I sort of have mine in a couple of stages. So I always have an EDC kit. Okay, I'll run that through on another video at some point. But in the EDC kit, I always keep a few small items. So we have your steri strips there, your skin closures. In there we have a little bit of medication, paracetamol, ibuprofen, diorolite. I'm a celiac, so I have a few health issues, Buscopan and Imodium, that sort of stuff. I also keep antiseptic wipes, a face shield for CPR, and a bunch of plasters, as you can see in there. So that's with me every day, without fail. I always take that to work with me. I take it if I'm walking downtown. Obviously, if I'm walking downtown, I'll take the knife out of it. It's only a little Swiss Army knife, but you don't really want to get caught with that sort of stuff without a good reason. So yeah, that goes with me every day, everywhere. I also take a couple of these guys. So we have these for washing out eyes. I live in Worcester, or near Worcester. We recently had an acid attack on a child. You might have seen it in the news. So these are also okay for using on acid, to sort of spray over the person's face or anything along those lines to try and dilute the acid. Obviously if you've got a bottle of water, that's better, but first case scenario, you can get these out, crack them open, clear the person's eyes and airways if necessary, and then shout for help for somebody with more water. So I also keep that with me as part of my ADC. And I also have a trauma kit. So to open this out quickly, it has another face shield. Again, this bit stays with me every day. I'll even just throw it in my bag if I'm going downtown, or it stays in my work bag if I'm at work. So another face shield, gloves, combat bandage. So this is really designed for bad bleeding, but of course obviously with the face shield it'll also work for CPR and responder gauze. Okay, so that's for wound packing. So bandage for your arms and legs, anywhere that you can get a bandage on and get a decent compression. If you can't get compression, then it's the gauze. So yeah, that's everyday sort of carry. However, if I'm going down to the woods, I will add my trauma kit and my bigger first aid kit and a tourniquet. So the tourniquet goes in the top of my bag. I always take this if I'm going to the Cubs, especially if we're going out anywhere. You'll see why it's much more in-depth first aid than just the just my normal EDC kit. So tourniquet for terrible wounds, amputations, that sort of thing. That one stays in my kit. It's mostly because my kit stays in my vehicle, mostly for car accidents and things like that. I'm a firm believer that everybody should at least have one tourniquet. So yeah, so this is the Maxpedition FR1. It's a really good pack. I'm actually really impressed with it. I've had it for maybe 2 or 3 months now. So yeah, so first on the front, shears. Don't really need to go into depth on those. Inside the front pack here are a couple of gloves. There's about 3 or 4 pairs in there that are sterile. First aid patch on the front, so anybody who goes into my bag and I shout grab my first aid kit, they know exactly what bag it is. And this usually stays sort of near the top or in a side pouch of my bag, depending on what bag I'm taking. So it opens up. It's got a tie here so that you can tighten it, and it'll only open that far if you want it on the side of your bag. So yeah, let's delve into this then. Again, another face shield. I think there's 2 or 3 in here. So face shield, again for CPR. You can obviously do CPR with that face shield, but it's nicer to have a face shield. Tape for small wounds, for little boo-boos. We have more eye irrigation there. Have an Israeli bandage. This is the one with the C-clip, so you can get some decent compression on there. Some wound gauze for sticking on. Whistle, if you need to get somebody's attention. Whistles are great. This is the Scout model. I think this is a present off my wife. Tweezers, simply for splinters. Got to have that with you. First aid card. This will just take you through, Dr. ABC, how to deal with bleeding, shock, broken bones. It's just to jog your memory. It's all stuff that we should know. I'm a firm believer in first aid, as I said, but it's nice to have something just to jog your memory if you're struggling. Pad of paper and a marker pen. Always have a pad and paper and a marker pen on you. Marker pen, if you have to use a tourniquet, you can either write on the person's head in blood, T, or use a Sharpie, or you can write on the time. So yeah. Emergency blanket, helpful in dealing with shock. Your body temperature will drop, especially if you've lost a lot of blood, or your patient's lost a lot of blood. Get a blanket on them, help them stay warm. And this is one of the SOL ones, I think it is. So it's a good quality mylar blanket. Orange as well, so you can use it for signalling if you need to get the attention of ambulance. Torch. Good quality AA torch. Spare pair of batteries in the bottom of the bag as well. Sterile triangular bandage. You can use it for multiple things. I also always have a shemag in my bushcraft bag because it's multiple use. You can even make a tourniquet out of a triangular bandage and a shemag if you needed to, maybe using your torch as the ratchet device. So yeah, to get more tension. And then in the front of the bag we have odds and sods. So we have low adherent dressings, a couple of wound clots. I think there's 3 or 4 in there, the 5cm ones. Those are the ones with a hemostatic agent in, so you place them on the wound, bandage over it, and it will help stop bleeding. And then we have 4 or 5 burn gels. If you're in the middle of the woods and you burn yourself, it's bloody horrible, it hurts. So yeah, pour a bit of this on it, leave it. You might not always have access to sterile water. Some of the guys will take a litre of water with them, 2 litres, or you will collect your own water and sterilise it there. The problem with sterilising your own water is the only way to really do it and have it good is by boiling it. Then you've got to wait for it to cool down. If you burn yourself, you need to get that cooled down as soon as possible. So I always keep a couple of burn gels on me. And I think, oh, what's that? Ah, yeah, need must. Tick remover. Okay, again, I always make sure if I'm in the woods I have a pair of tick removers on me. I'd forgotten that they were in the bottom of there. Maybe I need to remember that one in the future. So yeah, like and comment if you found this helpful. If not, then please note anything that you think I should do. That's great. Cheers, guys.